I'm your host, Dr. Ravitz, and I'm not your average neurologist. My interests and passions run deep, and I'm constantly pushing myself to find truths. I'm a medical doctor, a woman, a surfer, a runner, and an exerciser, and an avid reader of all topics. It's not easy to sift through all this information, and there's many podcasts out there. So let's try to get through this together. So, hello everyone. Welcome back to the Ravitz Way. I'm super excited for this episode. I met Dr. Grover, let's say 2015? Is that correct? 2015 or 2016 was when I first met him. Dr. Grover is an acupuncturist and a chiropractor, and he is amazing at what he does. And I'm so excited to have him on this podcast. I want to talk about how East meets West. It's something that my patients always ask about. It's something that I'm curious about. And I have to say, Dr. Grover helped me a lot with headaches and neck pain and different things as I needed them. And really excited for you to be here.
Yeah,
so,
I'm real glad to be here. Thanks for making this happen.
You're welcome. So give us a little bit about your background, like what you studied, just overview.
So I did my doctorate in chiropractic at New York Chiropractic College, now known as Northeast College of Health Sciences. Initially one of the first schools that kind of pioneered breaking away from the traditional chiropractic model to focus more on integrative health, trying to find a way for chiropractic to just blend in more with being integration with physical therapy, working with medical doctors, having better communication, and just really focusing on a whole health approach, a lot of nutrition education, and ultimately that kind of opened the door to forming a school around Eastern medicine, which is how I found acupuncture. So the school was great because you're able to study both East and West at the same time, and I was able to pursue my Master's of Science degree in acupuncture and Chinese medicine.
That's amazing. How long was that, just out of curiosity?
So the chiropractic degree is roughly 4 years long, about 2.5 years is straight your basic sciences and anatomy, and you kind of graduate into more of the clinical rotations and residency and whatnot. And acupuncture standalone is a 3-year master's degree program.
Great.
So roughly 3,000 hours of training.
Great. So I love that you said the integration of both, actually, because this is a constant thing, as you know. It's the healthcare system is extremely fragmented, and what happens is you end up going to a doctor, then to a specialist, then you might on your own turn around and say, well, maybe I should think about some other ways to treat this, quote, holistically or just in a different way, right? So I think it just is really hard sometimes for patients to navigate, one, their own healthcare journey, but to actually look at these things and find somebody who is good and serious and open. Both sides kind of have to be open to each other's practices.
Definitely.
So I think this is amazing. I myself have you've treated me many times. I think it's amazing. And my patients are always looking for this. And I think particularly let's talk a little bit more about acupuncture, because that's something that I think a lot of people are very interested in. So give us a quick, I read about this a little bit. I'm definitely not the expert. So tell us maybe a little bit about what acupuncture started as or is, and maybe a little bit of the science behind that.
Sure, for sure. So classical Chinese medicine was all about creating this system that really took a patient-centered approach to ask the patient questions, to observe them, observe their body language, see how they respond to questions. Because back in the day, it was a lot about people never really wanted to say how they're actually feeling. So the providers were trying to dig a little bit deeper and extract information through different ways, so they can pair maybe a patient complaint with a little bit more detail, like looking at the patient's tongue, feeling their pulse, feeling
I always wondered about the pulse,
like
what that's actually doing. Are you actually looking for just like a racing pulse because someone's super anxious about talking about their stuff?
It's definitely a thing. I mean, it's a way now we use it as a tool to confirm information, versus originally when it started out, it was more of a diagnostic to come up with a Chinese medicine assessment. So if a patient comes in now and they're, macho New York City, just workaholic and, going to the gym all the time and saying like, hey, like I just got this tingling going on in my foot. I don't know really where it came about. Like nothing ever bothers me. I never get sick, things like that. And, we may look at their tongue or feel their pulse, like, because we want to confirm that energy of like, okay, they have this robust, we say yang in Chinese medicine.
Okay.
They have this robust yang energy to them. Like they probably have a strong immune system. They probably have a strong GI system. And we look at their tongue, we may see specific indentations or like a deep midline crack or a red tip is another thing that we look for. And then we feel their pulse, and their pulse might feel, we say, deficient or weak, and may not be as racing or as healthy or as balanced as we're looking for. So pairing all that information together, we start to suspect that we're missing something from the clinical picture here. Let's see if we can dive a little bit deeper and ask this patient some questions to extract what that weakness may be. Like, is it that they have a lot of Red Bull in their life? Like, is it that they actually have a real poor sleep cycle, but wake up, energized and ready to go every day? So that's the kind of investigative approach that was formed in the roots of Chinese medicine.
It's very cool. It's very, very cool. So, all right. So let's dive in. Let's talk about. Let's dive right into migraine. So you could even use me as an example. My patients know that I get migraines, and a lot of patients like me and in the community basically, get a migraine here and there. They can deal with it. They come to me. We figure out, we diagnose them the best. We diagnose them. We give them an option for treatment, but sometimes it becomes more frequent and they don't want medications,
right?
Or they actually want some modality like acupuncture to treat either an acute headache or to make them less frequent. So how would you approach that? So
it's different for every case.
Yeah.
I think there's this misnomer in acupuncture where every migraine is treated with the same, 10 or 15 points, which, it's actually very different because, for your case, I may be treating you face up and using a certain combination of points, which is very specific to how that pattern manifests within you. Like, is it that you need to be in a dark room? Is it that you have visual disturbances? Is it that it comes around at a specific time of the month related to hormone imbalance? So all of those things that we talk about when we're doing our assessment helps us kind of come up with what we call our point palette.
Okay.
And, a migraine, headache, these things.
So when you say, I'm going to interrupt you. So
Sure.
the point palette, explain that a little bit. So
That's,
there's like
as a provider, how we kind of narrow in on which meridians we're going to be working on and which points we're going to be using on that specific treatment.
and excuse my ignorance, the meridians. So this is, explain that.
These are pathways that have a lot of overlap with our nerve pathways throughout the system. So you have your lower back nerves that go down your legs, and your neck nerves that go down into your arms, and different branches and pathways that wrap around the rest of your body. So these are pretty intertwined with meridians, which have names in Chinese medicines that are after organs.
Okay.
Like we have a lung meridian and a large intestine meridian. And often, there is some connection on those meridians having an impact on certain GI or, cardiovascular systems. But more specifically, it's connected to musculoskeletal. So like the large intestine meridian has a direct correlation through that C5 nerve root pathway. And that's, something that
up in here.
That's going
so
up in here.
Yeah.
You come down into the shoulder a bit. So we tend to work on those. And, a purist in Chinese medicine might say we're unblocking energy in that meridian.
Okay.
But somebody who's trained in a little bit of both will really kind of connect with their patient, educate them on, okay, the deltoid muscle over here is actually involved in that specific nerve pathway. And we're just trying to increase some circulation there. And we're also trying to work on the nerves in the area to release some hormones and get your body to fight inflammation better. So meridians in Chinese medicine, whether it's acupressure or acupuncture, is you can kind of think of it as our map of the body.
Okay. All right. So back to... So let's say a migraine patient. So, I thought there were specific points.
Yes.
So if you look up online, they
There's
always go to the
points,
hand to the hand point, and I think there's like one on the top of the head.
Right.
And I've had patients ask me to do trigger points in these spots, and I'm like, these are really tender spots,
Real sensitive spots.
really sensitive spots, and our needles are much bigger than your needles. So I'm always actually a little nervous about that. But then people tell me that they do it to themselves, which again, interesting. So let's get into it a little bit. So let's say for a migraine patient, like maybe give an example of how you would sort of look at that and where you would do.
Like when we come up with a point palette, we pair that with palpation, so feeling around those meridians.
So you're looking for like tight spots?
Tight spots, feeling around the patient's neck, feeling around their head. Even you alluded to this point up here, which is a phenomenal point for releasing pressure from the head. Every time I do put a needle in there, my patients will usually say, it feels like you just took air out of my body.
But they didn't. You didn't, right? You didn't.
No. Yeah. We're not deflating anybody. But yeah, so I am actually a little bit reluctant to needle this point on a new patient. It's something that I might work my way up to, building trust in the body and releasing tension along that same pathway and meridian to free up any interference that might be going on there. Because we find that in migraine cases that this point does tend to be very sensitive, and even massaging it can give that patient some relief. Now, from the science perspective, we are trying to create these shifts in the body, which cumulatively will reduce the inflammation and try to get the body to self-correct. Chinese medicine, in a case like this, it's an excess pattern. So we're trying to reduce excess and regulate flow in the body. That's the treatment principle of how we kind of face a case like this.
Gotcha. Okay. So for somebody that's getting maybe more chronic migraine, like couple times a week,
sure,
what would be a reasonable expectation, if they wanted to come for treatment? Like, how long would they have to come and how often? Because they're always asking me those questions.
So generally, my goal would be to, in somebody who's dealing with anything chronic, is to build trust in the body. So in the beginning, it would be more frequently, like once a week we're talking about. And ultimately, my goal with every patient is to reduce that frequency. In Southeast Asia and a lot of communities where acupuncturists are common, we are kind of like primary cares, where we are there for our patients, but we want them to rely on us less and have more independence outside of the clinic. So for that patient, while I would be starting out at weekly, my goal would be to make a change in the clinical picture and then ultimately try to have them take maybe a week of a break and come back in 2 weeks and see how the clinical picture manifested. Did we get it down to once a week? Did we get it down to it didn't return at all? Like what that type of response is.
Gotcha.
Now, every now and then, we won't see as much of a change, and that'll usually indicate us as providers to change the treatment approach up. It could be working on the other side of the body. It could be increasing the intensity of the treatment. It could be decreasing the intensity of the treatment. So there's a lot of different small adjustments that we make to the actual protocol we're administering to try to get results to last longer. Ultimately, a case like that, if we're able to break the cycle, it's very rare that the patient won't need any follow-up supportive care. They'll still kind of need some ongoing maintenance, supportive type of treatments, which the goal would try to be to get that frequency down to once a month or once every 6 weeks. And of course, co-manage with the experts like yourself to making sure that they're getting everything they need.
Gotcha. Yeah. So this might be a dumb question, but when you're doing the needles and you're doing it over and over again, is there science behind, like, are these pathways to excess? Are we trying to change like levels of different types of inflammatory markers, let's say, or neurotransmitters?
So there's definitely the Western component related to hormones and neurotransmitters, like spot on with that. So basically, when we set a needle, we are working with this collagen network that's found throughout our body, and there's this specific cell, the mast cell, that is activated when we are needling or even scratching a surface. Mosquito bite example, like we have that instant gratification.
So you get a mast cell reaction.
Yep. Exactly.
Oh, exactly. I see. So itch. Okay.
So similar effect occurs with the needle, and when we are setting that point, there's this effect that takes place which can release certain hormones, neurotransmitters.
So the needle goes in, mast cells are activated.
Yes.
Okay.
And that's supposed to unblock pathways that are going through your nervous system.
Gotcha.
Now, for us to say, hey, I'm going to set this needle and it's going to specifically target serotonin, that is very difficult. And, even as acupuncturists, we say that, how do we know that that's what that patient's body needs? Let the body decide for itself. Though we can try to have an impact on the body to excite certain areas of the body or relax other areas of the body. So
yeah, it'd be interesting to know. There's probably a lot to learn about that because I think it's doing something. It's
definitely there's a lot to be studied. I think the other thing that comes about is the studies that are discussing a lot of the histamine release in the body. Specifically to the pain pathways. When that is activated, we're using the needle and we're trying to get the cells to come to the site. Obviously, just like you're going to get a cut on your hand, and if you had a paper cut or what have you, the body does have the ability to repair that tissue.
Yeah.
Now, orthopedically speaking, if a patient's dealing with chronic musculoskeletal tension or knots in a specific area, the body's not actively working on it. So us creating those new injuries using our acupuncture needles, we can excite that response of cellular repair in the body. And really try to force the body to recognize that there's a problem there. That area needs good circulation, good oxygen supply, and just needs to heal itself. They bring
attention to it, yeah. So we as you know, we do similar stuff with, quote, dry needling and trigger point injections, and even there's some data that shows that trigger point injections with something in it are just as effective as
without.
Sorry, the dry without is just as effective, which is super interesting.
Like the lidocaine or
yes,
bupivacaine,
exactly.
Right? Yeah.
So interesting, in a different time to argue that, but it's super interesting. Let's pivot to an acute injury. So I definitely had a patient that came in and hit their knee and the knee swelled up and. Yeah. This is an older lady, amazing actually. She, didn't go to the doctor and just went to the acupuncturist who stuck so many needles in her knee, 50 needles. And she showed me the picture and I was, amazed / horrified / and
what do you think?
Yes,
did it work?
Did it? Yeah. And basically the swelling went down in a couple days. And I thought to myself, well, okay, if she came to me, or a doctor, she would get an X-ray and some anti-inflammatories and ice and, whatnot. But it was really fascinating. So can you comment on that? And then we'll get into low back pain or neck pain, because that's a big thing.
The acute injuries are interesting. You have the whole old school Rice protocol, right?
Yeah.
You're doing the resting, the icing, and you're doing the elevating and the compression, right? So with acupuncture, generally those acute injuries, we are using the thinnest needles we can physically use to create change in the area.
Okay.
So again, we're trying to create this response in the area where we're not going to make the problem worse, but we are going to pull some resources from the body.
Got it.
To come to the area and recognize that there is a serious problem there. So, the 50 needles approach in that area is really, I'd say, strong for treatment.
I don't know if it was 50. It just was a shocking
but it
picture.
It is alarming to see after somebody's acutely injured.
Yeah, a swollen thing with a bunch of porcupine. It was intense.
But the results usually are pretty dramatic. It
was dramatic.
Some acupuncturists would even go as far to say is you don't even need to go in the inflamed area, that you can treat it above and below and you will get a very similar outcome without taking the risk of further irritating the area that's already so swollen. So generally with my approach, if I see something that's pretty acute, I'm usually working above and below.
So you do that with, so about back pain, let's say that's a super common thing, right? You twist the wrong way, you get a horrible pain, there isn't usually so much to fix. You definitely at some point might want to see a doctor and check things out imaging, and definitely do physical therapy. But these people want immediate relief. And if you've ever had a low back pain, you want immediate relief. Want immediate relief. So how do you approach that? Is that right to the? I mean, there's nothing really super swollen typically, right?
So generally, we're able to go right into the paraspinal muscles of the back. The back is a fascinating anatomy, the way it kind of developed with the different layers of the soft tissue, how they attach to certain structures. And with a nice gentle insertion, and we use different heating modalities, electrical modalities, cupping at times, just to get some blood flow going. But really setting that, 1.5 inch needle like in the right area comfortably enough for the patient to relax.
So the depth you're talking about.
The depth,
yeah.
right? Comfortably enough for the patient to relax, especially while you're lying, most of the time face down, prone on your stomach. We set the needles pretty shallow at first when those patients lie down because they are so acute and everything is so tight. And we let the body relax a little bit, let the patient focus on some deep breathing, and then slowly but surely we will like advance that needle a little bit deeper into the body. And it's magical how, there's so much resistance when we first set it, but after them about laying there for 15 or 20 minutes or so, we're really able to get some depth. And, as a provider, that's clinical feedback that there's a change in the area. There's an increase in circulation. The patient breathing allowed those soft tissues to unwind and really break down that hypertonicity in there.
Yeah. It's amazing because we don't have, pills that can do that or ways. And I think, physical therapy is also a big part of what I believe in and what you believe in as well, but you can't move when you're so tight. So
that's like the phases of treatment that I think make, the acupuncture community that's now integrating more with the Western community so valuable, is that people are looking for a holistic approach. And, we all know that movement is the key, but what's the natural fix that's going to allow them to have the confidence to be able to go to physical therapy, knowing that they're not just going to be laying there on a table the whole time. So us, whether it's acupuncture, soft tissue specialist, or just, kind of working those pathways and increasing the blood flow really can, even just a patient getting off the table, can really restore their confidence that okay, maybe I'm ready to be challenged in physical therapy.
Yeah, you're right. The turnover is like just actually physically turning over sometimes is terrible. So,
for sure.
So the same applies for the neck?
Yeah, so the same applies for the neck. It's interesting because we get a lot of is it shoulder, is it neck, is it a pinched nerve? I'm sure you see this in your practice all the time.
All day long. And
the nice thing with acupuncture is that we can kind of treat a little bit of all of it at the same time. So when patients come in, while it is really important to be as specific with the diagnosis as possible to give them a clear outcome of what their plan is going to be as far as recovery goes, while you're there, when it's holistic, it's always great to do a little bit extra. Is it treating shoulder, neck, the nerve pathway all together at the same time to make sure that if there's anything else in the background that's maybe blocked or inhibited, that may be limiting range of motion, that we free that up there too while they're here on our tables. And we talk about other things. We talk about sleep, we talk about digestion, and even if it's a neck or a shoulder, there's ways we can assist with those other things while they're here on our tables.
Yeah, super helpful. It's definitely, we focus on one part because that's not, we tend to for the diagnosis because we kind of have to. That's the way insurance, it's the way the specialists we've been taught, but also how insurance pays for things and so forth, which is frustrating. But it is, if your neck hurts here, your shoulder's going to hurt too, and your arm is probably going to hurt too. So it's yeah, I love that. So, all right, let's segue to sleep. Yeah. So how does this work for sleep? This is, it's at least give me your opinion because it's super interesting.
So
nobody can sleep here. This is New York City. Nobody can sleep.
Sleep is one of the most, I feel complicated things to treat in New York, and one of the most frequently checked boxes on my patient's intake form.
On the side, right?
When's the last time you got a good night of sleep? The answer of it being yes is very, very infrequent.
Okay.
So, again, just like migraines, it's something that's very specific to the patient. Is it that they can't turn their mind off at night because they start to get racing thoughts, regardless of how much energy they spent that day? Is it just this anxiety pattern? Or is it that they get hot at night? Or is it that they get cold at night? All of these things in the body allow us to pick our points based off of their response. And I feel often in New York, it's also excess patterns, similar to the migraine, headache type of presentation we talked about. And a lot of what we're doing is trying to harmonize and reduce as far as treatment principle goes. But there's points there's one here that's... the Chinese name for it is amnion. It's behind the mastoid process.
So behind the back of the ear.
Yeah. And it translates actually from Chinese points. Acupuncture points are labeled in pinyin, which do have English translations. And the translation of that one is peaceful sleep.
Huh.
And I trained in acupressure, and they say when you do acupressure, even if it's on yourself, that if you massage this point actually 100 times,
100 times,
100 times
Just
before
do
bed, that you can actually
like
feel
circular?
a sense in a circular motion, that you
Okay.
can actually feel a sense of relaxation in the body. So that is
100 times.
that is
Okay.
a safe at-home technique that we can do that really is a real powerful
I love
point
it.
for us as acupuncturists.
So 100 times, we'll see if patients can do that, because, you know, the whole attention span thing. But 100, they have to get to 100.
50 or
Yeah,
60.
they will. They're going to check out, but maybe they'll fall asleep.
Maybe
so
they'll
that's
fall
cool.
asleep doing it, yeah.
Yeah.
But it is a powerful point, you know, and again, like...
So a lot of them are into the ear too, right, for sleep?
So
What's that about?
Ear for sleep is really good. You know, the ear is an interesting thing because in acupuncture, there's a lot of microsystems.
Okay.
And I train in the VA hospital, and we did a lot of work like with neurological conditions and PTSD.
Like TBIs and PTSD.
Exactly,
Amazing.
Exactly. And, you know, they formed some protocols around needling the ear because it was the fastest way to see a large group of patients, because the patients would typically be seated.
Oh, and just get a needle in the ear?
And get some. So we do 4 needles on each side in the ears. And, you know, whether it was chronic pain, failed surgical back syndrome, PTSD, sleep, all of it, like that was all encompassed in that protocol.
That's awesome.
And
how many patients did you treat?
Generally in that setting, it'd be myself and my head clinician, and the two of us would be treating 40 to 50 at a time.
Wow.
So
That's amazing.
You know, you just go from one chair to the next and set the needles, and we had a timer on and everything. And
what kind of outcomes did you have?
Pretty good.
That's
I mean,
awesome.
even if part of it was just like, you know, the music being super meditative and just creating that environment, and just you know, being able to sit back in a chair and close your eyes and relax for a few. You know, you go to these like old school medical systems for care when you're dealing with a chronic morbidity like failed surgical back syndrome or whatnot. It's depressing, you know. I mean, it's not motivating to get better. A lot of those patients really struggled finding the courage to go to physical therapy, and you know, it's a way to kind of bridge the gap to get them off of medication, and use this as a tool to really encourage movement, encourage exercise, encourage release of those feel good hormones, and
they were sitting together.
Yeah, in a big
room.
Yeah,
I like that too. That's kind of like,
there's a lot of community acupuncture clinics that are popping up that are
sort of doing that,
same
right?
approach,
Where
you know?
people are. I didn't know that, but
we're trying to make it more affordable, more accessible, and you know, I mean, it's.
But also, it's like community in like a weird way. It's sort of a community of like-minded or like-suffering type things.
Like
where
going to yoga. And,
Huh. That's cool.
But yeah, the ear's pretty powerful for sleep. You know, I find that if I'm doing my job the right way, for my sleep patients, they will fall asleep on my table. So that means that I have my point palette down, like specific to their imbalance.
Yeah.
If they're there and they're like, Dr. Grover,
totally
I'm getting
awake.
excited.
Yeah.
I can't sit here. Like, I need to get out of here. Like, I have work to do. Then I know that, okay, my point palette might be inaccurate because I'm exciting their body a little bit too much.
Gotcha.
Yeah.
That's great. I have another question. So this is so much fun because I get to ask all the questions I always wanted to know the answer to. So this happened to me a few times, and also to some of my patients. They tell me, like, you know, when you get more needles in, you're kind of like a piece of meat on the table, and you don't want to move because, you know, that happens. But 1 or 2 times, like, I felt like I had like I was sweating like a lot, not a little. Like it was like something was happening. Do you see that a lot, or is that normal?
Yeah.
Or
so
I mean,
there's
if it's not normal, it happened. But
so there's a principle when you're training in acupuncture. Like we basically have condition and treatment protocol / principle of what we're trying to accomplish on the body. And like I think I've alluded to, like harmonize, downregulate, increase activity, decrease activity. There's one which is called release the exterior. So usually that has to do with there being some imbalance or blockage somewhere in the body. Now it could be your immune system. It could be somewhere in your soft tissue, like a trigger point that's inhibiting blood flow. Usually when you get that release, it means that whatever that blockage is, your body's trying to self-correct. Okay. So your body's response to self-correcting without you asking to do it, it's kind of overwhelming. Like your body's like freaking out, like it doesn't know what's going on. So that's one of the releases that we see on our table. Sometimes it's emotional. I mean, I've had patients.
No, I've heard that too, where they just cry and cry. Yeah.
Sometimes it's laughter. I mean, it's pretty amazing
Really?
it happens. It happens. It's pretty amazing what it could be. And
What's the funniest thing you ever saw?
Probably the tears and laughter.
The
to be honest,
tears and laughter at
Tears
the
and
same
laughter.
time?
At the same time. At the
Okay.
same time. Yeah. That was a first. That was a first. That was probably 2022. I still remember very, very,
Yeah.
very
Were you just
specifically.
like good, bad, good?
Yeah,
bad?
I was, yeah, exactly. Yeah. It was fortunately good. It was
Yeah.
fortunately good. We did some great work in that case. So,
Huh.
but yeah, that combination was, yeah, there was a lot of blockage there, a lot of stuck energy, a lot of just,
Amazing.
lack of sense of direction in life, and a lot of there was a lot of emotional trauma there, like just, recent death in the family, and patient was holding a lot in and still carrying that excess yang energy, and it just had to come out.
I like that. Okay.
Yeah.
So it might be a dumb question as well. Depression, anxiety. Do you do that?
Yeah, so a lot of depression, anxiety. I find that it's something that patients start to be open to working on after we solve something more acute. So
Gotcha.
that
It's
knee
like a
case,
pain maybe, or
yeah. So they come in, we'll usually resolve one of those orthopedic issues or neurological issue, or make some dramatic improvement enough for the patient to be open to discussing some of the deeper imbalances. And for us as acupuncturists, we're really trained to listen and ask questions to try to extract as much information as possible to help those cases. And I find that with the anxiety and depression kind of combination, it's just trying to find a stride of feeling that right level of good. Sometimes it's these real roller coaster of emotions. I was feeling great for 2 days, and then I crashed hard and I went into a deep dark hole, and I was feeling super depressed. So we're always just trying to stabilize mood and emotions, and just educate our patients that there's going to be some shifts that are going on which may take you to both extremes while we're on the recovery pathway, but we're just trying to stabilize that and have what we say less episodes, right? So if you had an episode last week that took you into that depressive state for a few days, we're trying to make sure that if we're keeping a log, that in the next 6 months that those episodes decrease, because then we know that they're doing everything outside of our clinic, and we're doing everything we can with our medicine in the office, physical, manual, needling, cupping, discussing dietary therapy, and all of those kind of integrated modalities together to allow the patient to break the cycle. And similar to the injuries with physical therapy, sometimes it's mental health, sometimes they just need a therapist, and they may not have the confidence or comfort to even seek that out, and acupuncture might be the thing that unlocks that. The patient recognizes that, hey, that is a tool for me.
Yeah. For chronic pain, I'm sure that's huge, right? Yeah.
Definitely. Yeah.
Okay. Is there something else you want patients to know about?
Well, I think, look, the acupuncturists we're very, very well trained in Chinese medicine, but not a lot of acupuncturists have the confidence or ability to talk to your neurologist, for example, which I think generally forces patients to be less willing to trust them, to try it.
Gotcha.
Generally speaking, it is very, very safe. Our training to set the needles is extremely advanced, and there's a lot of regulations in place that force us to really have to keep up with certifications and continuing education. And it's a very comfortable experience for the patients. And I think that if a patient was out there looking to try it for a condition, it doesn't have to be something that is severely debilitating. It could be something that, hey, I just wanted to try it to see if I sleep better, or if I get more energy out of it, or if my appetite is really strong. Maybe if I try it, I might have a decreased appetite. Could be something as simple as a curiosity symptom than an actual condition. And I think that if that's your first experience with acupuncture, you might feel a lot more comfortable and relaxed when something hopefully not serious comes up in your life, to allow it to be a tool to integrate into your overall care plan to get better.
Yeah. Well, listen, I think that doctors in general, like I think now we're a lot more open because
we're in GI clinics, we're in OB clinics, we're in especially the hematology oncology world. I mean,
really,
with chemo kind of inducing a lot of dryness and also a lot of post chemo nausea.
That's amazing.
Acupuncture is phenomenal at treating some of those things, and obviously those are such delicate cases. It's like the more supportive care, the better the body will take up. I mean, even nutrition, right? Like some of the best hospital food is specifically made in those kitchens of those wings of hospitals, because everything that's going in
has to be
from
so particular. Yeah. Interesting. So when you see like a doctor that's kind of fresh out of school and never had a day of acupuncture in medical school, which is, I actually had a little bit where I saw, because they had like a Ayurvedic and another rotation where they talked about it a little bit, but it basically I had to take an interest in that, and they had to, I had to be in a space where they would present the information to me. But I think there's plenty of places where you don't get that. So you get somebody out, coming out, they just did years and years of residency and maybe a surgical residency, let's say, where they're not as focused on that. What would you tell them about maybe safety, because we worry about that. That's always we're always worried about what's safe. How deep are you going to go with these needles? How much, infection protocol, that kind of thing. Because I would imagine those are the biggest risks, right? There's sort of depth of needle and infection, right?
For sure. So, like we practice clean needle technique, which requires us to sanitize the patient's skin in the specific area that we're going to be setting the needles right before insertion. All the needles are brand new.
Yes.
They're all sealed. They all have serial numbers on them. They're never reused.
They're disposed
used once
of.
And they're disposed of. So I think that, like I used to lecture at New Jersey College of Medicine for acupuncture to first and second year medical students. And
how many lectures, just out of curiosity?
It was one course, but
it was a course.
Ongoing.
Okay.
Yeah.
That's
great. It was
great.
like an elective type of course. Okay. But I was basically, I went a few years in a row at the same time of the year.
Gotcha.
So there, when I would go to Rutgers over there, it was amazing because the interest in this stuff now, especially coming about over the past 10 years of practice that I'm in, is exponential. And I think it's like, whether it's doing acupuncture for scar tissue after surgery to help with recovery, or even if it's just knowing how to answer the question of when a patient is inquiring of, hey, like, do you think that I should be doing acupuncture at the same time while I'm recovering from like long COVID, for example? A lot of doctors don't know how to answer. So, so it was really neat to be, in that academia setting and see like how things have shifted from 20 years ago to now.
Yeah. So the answer to that is yes, correct?
Yeah.
From your standpoint as well. So,
yes.
The long COVID stuff I'm seeing as a neurologist, is for sure chronic migraine. But there's a lot of these other insidious kind of symptoms that we don't know what to do or how to deal with it. So, autonomic dysfunction, which is probably some sort of catecholamine imbalance and surge. We don't understand it that well. A lot of these poor people have like a POTS diagnosis now, and the treatments for these things we really don't have so many at all.
Very limited,
dizziness, fogginess, poor sleep, loss of smell, loss of taste. So we don't have a lot of treatment for this at all. Yeah. So my answer, if someone asked me, that would be a resounding yes. For sure wouldn't hurt.
Yeah.
But I was wondering if you guys had data on that.
I think it's amazing because, a lot of these things, like symptoms that you just mentioned, that are associated with the experience of having unfortunately COVID for much longer, or testing positive and having like this unfortunate sequence of events that led to like long lasting lingering symptoms.
Mm-hmm.
These patterns and symptoms are in our textbooks. Like there's Foundations of Chinese Medicine. They're like the Grand Master book that we study when we go through by Giovanni Maciocia. Like it's in there. Like these things
like a
are
post-viral,
yes,
like something, like post-viral something.
It's labeled something different. However,
I believe it.
It's something that thousands of years ago when they were writing these books, and coming up with all the content of like, okay, like somebody undergoes a viral experience, they can the outcome can be like one of these 5 things. And of course, like we as providers before COVID infrequently saw it, and now is this one thing that had become frequent with this specific string of symptoms. And it's like, how do you treat loss of smell? How do you treat loss of taste? How do you treat fatigue? And you know, we have points. We do
there's
cupping.
Points to treat. Wow.
Yeah.
I love it.
So,
no, we have the same. Listen, I don't think it was actually as specific, because for us, it's a lot of times, not a lot of times, but when we initially learned medicine was treat the acute thing. So like your virus is gone. So like maybe Epstein-Barr is a good comparison, right?
Sure.
Mono. So you get mono, you have these bad symptoms. They're longer than they should be anyway. And then sometimes they can be really long. Yeah. And again, we don't have treatment for that. We don't treat the virus anymore. We don't treat the, you know, maybe in a super crazy case, a debilitating case, we'd give them sleep aids or, you know, things to help them focus. But I don't like to do that. That's not, and patients don't want that. They don't want that. They don't want like a Band-Aid of something. So that's cool. That's very cool.
It's pretty neat. I mean, I think cupping is a cool thing to touch on because, you know,
I was
a lot of
different
that, like Eastern European cultures, old school, like Chinese medicine, like way people are raised is like, oh, like, you know, when I grew up, when I was sick, like my grandma would just cut my chest. And, you know, like hearing that from when I ask my patients on their first day of like, have you ever had cupping before? Like every now and then that comes out, and it's amazing to me that it was, you know, you still.
So what would they do? They would just like use
glasses, basically, like a glass cup, some sort of lotion or some sort of topical. Like now, like Vicks is a perfect example.
Yeah.
And then we use an alcohol pad, or they would create a cotton swab soaked in some sort of alcohol to essentially suck all the air out of the cup and create a vacuum effect and create some suction.
That's pretty.
And they would
cool.
do it on the chest. And it's amazing because like Chinese medicine like has a lot of different training techniques and protocols about treating acute colds and treating pneumonia and treating anything upper respiratory really, which, you know, we're not here. It's not within our scope, but like you go across to another continent and it's in the scope of that. You know, you have an acute cold, like you're going to their version of a Walgreens, which is a Chinese medicine clinic, where you're given herbs, you're given cupping, you're given acupuncture, and you're seen frequently. Like they want to attack that out of your body holistically as quickly as possible, so that, God forbid, you encounter the same pathogen again,
you're protected.
Your body has more defense against it.
I love it.
And it's much more affordable there too, is the other thing. It's like here, like, you know, of course we go to the pharmacy, we can fill a prescription. You know, like we do the insurance thing there. It's like straight, you know, it's out of pocket. It's like buying a bag of cough drops. Go get some cupping done for 3 days in a row next time you have an upper respiratory issue, and your response should be pretty strong. Yeah.
It's pretty cool.
Yeah,
it's very cool.
I mean, it's just a different mindset, right? Like of how we can treat it versus of, you know, let me do nothing, let me rest and lay low, and see how this manifests in my body. So, you know, I mean, us doing that treatment technique itself is similar to the acupuncture of like we are trying to like wake the body up and get the body to work harder and dedicate resources to an area that is compromised. And yeah, usually it's around the nape of the neck, from the upper chest area, from the top of the lungs, going around the back to the apex of the top of the lungs.
Very cool. Yeah. So let's talk about the money part, because they're going to ask about, and people are always wondering about that. Yeah. So, you know, I think acupuncture has come into, you know, the general, like people are looking for it and people are looking to pay for it and cover it.
Sure.
So most times it's not available in network, correct? It's that people don't have like a benefit for that.
Most times it's not, correct. So like now Medicare started to cover
really?
for some sort of arthritis related knee ailments, but only very specific acupuncturists are kind of available to, you know, be part of that paperwork processing network. I'd say in network is you know, it's pretty infrequent. I'd like to say it's more for like orthopedic related, like lower back pain or neck pain, but there's still a pretty like laborious paperwork process to even allow that insurance company to recognize us and come up to a contracted agreement to, you know, make us be the provider that a patient's going to be able to use their benefits for to seek us out. So they don't make it easy for us.
No.
Yeah.
They don't make it easy for us either.
Yeah.
Just so you know, I think you know. So basically, if someone wanted to come see you, we would have to see if they had
out-of-network benefits. So if they had out-of-network
specifically
benefits
for
acupuncture, yeah.
Okay.
And then the other aspect is just straight self-pay. You know, we realize that acupuncture is usually something you need more than one time.
Yeah.
You know, so we try to make it affordable. All of our sessions are private and one-on-one, roughly last 45 minutes to 1 hour. And then, of course, like, you know, just most importantly, like try to have some sort of packages available just so that in case a patient, like we talked about, like the migraine case, it's like if they need some sort of ongoing care, you know, you purchase a 5-pack of visits and we can kind of like space it out and try to make it last for the next 6 months or so. Yeah.
Great. Well, I love this. I love this. You know, I love this type of medicine. I think it's really interesting and complementary, and like another side of medicine. I would say that's, you know, was learned in one region of the world, and then, you know, Western medicine came and did its own thing, which is amazing as well. But I think there's room for both a lot of times. Definitely. A lot of times, especially for things that we tend to treat, you know, you and I. So things like migraine and chronic pain and chronic low back pain and neck pain and insomnia. Right. For things that we really want another modality, and patients do too. So it's great for you to come on here. Yeah. I'm excited. I heard you have a new venture now, yes, and tell us where people can find you. And
so thank you for having me, first of all. And I think you know, everybody out there who's watching, that, you know, if you have any questions or anything for us, you know, feel free to reach out to us. My new company name is drgroverwellness.com, orthopedic acupuncture and wellness. Based at 363 7th Avenue, 22nd floor, coming soon.
We're very excited. So I've been so excited to get you for years, for real, to be, I'm happy, you know, in our space, in my space now, because I think it's just it's a wonderful thing, and I can attest to your skills as a patient, but also we have many patients in common, and I'm just excited.
Yeah, so likewise. So this has been great. Yeah. Thank you.